Basic anatomy. Musculoskeletal system. Main functions. Gives shape to the body, allows movement, and protects vital organs. 1. Main components. Bones. Consists of the axial skeleton, skull, spine, sternum, and appendicular, extremity bones. Muscles. 3 types. Skeletal muscle, smooth muscle, and cardiac muscle. Joints and ligaments. Connect bones and allow movement. 2. Clinical applications. X-rays to detect fractures. Physical therapy to restore muscle and joint function. Detailed explanation of the musculoskeletal system. 1. Main functions of the musculoskeletal system. The musculoskeletal system is a combination of muscles, bones, joints, and connective tissues that function to provide structure and support for the body. Protect internal organs such as the heart, lungs, and brain. Allow body movement through the cooperation of muscles and bones. Storing minerals and fats. Bones store calcium, phosphorus, and fats that can be released when the body needs them. Blood cell formation. Bone marrow produces red blood cells, white blood cells, and platelets. 2. Main components of the musculoskeletal system. 1. Bones function. Provides body shape, protects vital organs, and is a place for muscle attachment for movement. Types of bones. Flat bones. For example, the skull, chest, and pelvis. Function to protect body organs. Long bones. For example, the arm and leg bones. Function for movement and supporting weight. Short bones. For example, the wrist and foot bones. Function to provide flexibility. Irregular bones. For example, the spine and facial bones. Bone structure. Bone corpus. The main part that is hard and dense. Spongiosa. Hollow bone tissue inside the bone that contains bone marrow. Endosteum and periosteum. Thin membranes that cover the inside and outside of the bone, responsible for bone growth and repair. Bone marrow. Red marrow. Located inside the bone, responsible for the production of blood cells. Yellow marrow. Located in the middle of long bones, functions to store fat. 2. Muscles. Function. Produce movement, maintain body posture, and produce heat for the body. Types of muscles. Skeletal muscles. Found in the body's skeleton, responsible for producing controlled, voluntary movements. Cardiac muscles, only found in the heart, work automatically, involuntarily, to pump blood. Striated muscles, found in internal organs, work automatically to move organs such as the stomach and intestines. Muscle structure. Muscle fibers. Long, cylindrical muscle cells that have the ability to contract and produce movement. Myosin and actin. Proteins that work together in the muscle contraction process. Tendons. Connective tissue that connects muscles to bones and allows movement. 3. Joints function. The meeting place of two bones that allows movement between bones. Types of joints. Synovial joints. Joints that allow free movement, such as the knee, elbow, and shoulder joints. Cartilaginous joints. Joints connected by cartilage, such as the joints between the spine. Fibrous joints. Joints connected by dense connective tissue, usually immovable, such as the joints in the skull. Synovial joint components. Joint capsule, a membrane that surrounds the joint. Synovial fluid, a fluid that lubricates the joint to reduce friction. Cartilage, covers the ends of bones to reduce friction and prevent bone damage. Ligaments, connective tissue that connects bone to bone and provides stability to the joint. 4. Connective tissue, function, connects, stabilizes, and supports the components of the musculoskeletal system. Types of connective tissue. Ligaments, connect bones to bones. Tendons, connect muscles to bones. Fascia, connective tissue that covers muscles and organs. Cartilage, provides cushioning between bones and helps joints move smoothly. 3. Movement process in the musculoskeletal system. 1. Muscle contraction. Muscles work through contraction, reduction in muscle length, which produces movement at the joints. This process begins in the brain, which sends impulses to motor nerves that activate muscle fibers. Contraction process. Nerve impulses received by the muscles cause the release of calcium ions from the sarcoplasmic reticulum, which allows interaction between actin and myosin in muscle fibers. When actin and myosin slide past each other, the muscles contract and produce movement. 2. Joint movements. Flexion and extension. Movements that decrease or increase the angle between two bones, such as at the elbow joint. Abduction and adduction. Movements away from the midline of the body, abduction, or toward the midline of the body, adduction, such as at the hip joint. Rotation. Movements that rotate around the body's axis, such as rotation of the head or shoulder joint. 4. Clinical application. 1. Disorders of the musculoskeletal system. Fracture. An injury to the bone that can be caused by trauma or certain medical conditions. Osteoporosis. A decrease in bone mass that causes bones to become brittle and prone to breaking. Arthritis. Inflammation of the joints that causes pain and swelling, such as osteoarthritis and rheumatoid arthritis. Scoliosis. A disorder of the spine that causes an abnormal curvature. Tendinitis. Inflammation of the tendons, often caused by repetitive use or injury. Herniated nucleus pulposus, herniated disc, when a spinal disc slips and presses on a nerve. 2. Diagnostics. X-ray. To see fractures or changes in the joints. MRI. Magnetic resonance imaging. to examine soft tissues such as muscles, ligaments, and spinal discs. CT scan, to get a more detailed picture of the bones and joints. Blood tests, to detect signs of inflammation or other medical conditions affecting the musculoskeletal system. 3. Treatment, medications, such as NSAIDs, non-steroidal anti-inflammatory drugs, to reduce inflammation and pain. Physiotherapy, to restore movement and strengthen muscles after injury. Surgery, to repair fractures. Treat herniated discs or replaced joints, such as knee replacement. Assistive devices, such as braces or orthotics to support injured or weakened body parts.